What's the difference between Renuva and AlloClae? When Renuva was introduced, it was a revolution in injectable aesthetics. This is a product that's derived from human fat, and it contains the extracellular matrix from that fat. Those are the proteins, the growth factors, the peptides around the fat cells. And the theory is when you inject this product into the treatment area, it induces your body to make more of its own fat. Renuva, though, is missing one major component, and that's structure. And that's where AlloClae comes in. In addition to having the extracellular matrix with the proteins, the exosomes, the peptides, the growth factors around the fat cells from the human donor fat, it also contains actual intact fat cells and the structural components of human adipose tissue. That means that in addition to inducing fat cell growth and the ingrowth of fat cells from the recipient site into the product, it actually ensures that there is room for those fat cells to grow and be biologically active. That makes AlloClae an extremely robust tool in cases in which we want to build volume in a focused and meaningful way. We're using AlloClae all over the body. Some of the really popular things with AlloClae that we're doing right now include breast augmentation as well as buttock enhancement. We're also using it in a lot of the revision liposuction cases we're getting from around the country and even around the world. AlloClae is an off-the-shelf solution for patients who could benefit from a fat graft, but don't necessarily have that fatty tissue available on their own, and for patients that could benefit from a fat graft, but maybe just don't want to go through the liposuction required to harvest that graft. AlloClae is especially exciting in the world of GLP-1 based weight loss because these are patients who are getting to their goal weight, they're losing the pounds, but in so doing, they're losing volume from places in a lot of cases that they don't want to be losing it, like the breasts, like the buttocks, like the hips. And because these patients have lost the weight, they don't have the fat depots available to do the fat transfer from which they would benefit. These are patients for whom AlloClae is a true game changer.